Croup is a typically viral infection of the upper airway, and this will oftentimes cause a fever in the child. They may have had a cold or some other upper respiratory infection to begin with, but then they'll develop more difficulty breathing and the signs of respiratory distress, and you oftentimes will hear what they call a barking cough or a seal bark cough. This usually strikes children starting at about 6 months and up to about 4 years of age. One of the things that can be kind of unique with this is if they get cold air. So if it's cold outside, when you take them outside, or if the parents have opened up a refrigerator door and is having the child breathe that air, sometimes that cool air can cause a reduction in swelling, and that will make the symptoms a little bit better. So that's just something to note. And if you have that, it's usually it is usually croup. Epiglottitis is a bacterial infection of the epiglottis. We don't see this as much as we used to because there's vaccines for it now. But it's still possible to see it. Typically, the child had some sort of upper respiratory infection and now has a much higher fever, is usually sitting up in the tripod position. They're oftentimes being fairly still. They're breathing through their mouth. They might even be drooling because their throat is so sore it hurts to swallow. With these patients and with croup patients, we want to administer oxygen. Don't put anything in their mouth. Don't put any OPAs or NPAs or anything like that in their mouth, and rapid transport to the hospital. Asthma is common in children. When we see a child with an asthma attack, they typically have all the signs of respiratory distress, so the retractions and the nasal flaring, and they're anxious and tachypnic, accessory muscle use, and wheezing. So either this is something that you'll hear audibly without a stethoscope, or sometimes we do have to listen to their chest. So you hear that wheezing. They've usually had some coughing with this, so that's something that you can ask about. When we're interviewing the parents or the child about their asthma attack, we want to ask things like how long this has been going on, when did it start, have they taken anything for it, have they taken any fluids, do they normally take any medications for this? And then somebody to ask is if they've ever been put on a breathing tube or if they've been intubated. Because if they have, there's a better possibility that that's going to happen again. As far as treatment for the asthma patient, let them assume a position of comfort. So that's typically sitting up in like a tripod position. Administer oxygen to maintain that oxygen saturation of 94 to 99%. If they have an inhaler, you can help them with their inhaler, and you might need a spacer with that. That's in another video. And then transport to the hospital. You can consider intervening with ALS or intercepting with ALS because there's a few medications that the paramedic might be able to give that the EMT cannot. However, primarily they need their rescue inhaler. Bronchiolitis is another condition that we see with children that we don't typically see in adults. It's very difficult to differentiate between asthma and bronchiolitis. Although with bronchiolitis, typically it's something that they've never had before. They might be running a slight fever with it, and with asthma, they usually have a history of it and the parents know about it. But expect to hear wheezing again. We're going to, again, let the child assume a position of comfort, which is usually sitting up, provide oxygen to maintain the proper oxygen saturation. If they have an inhaler, we can assist them with that. A lot of times they won't though, and then we just need to transport to the hospital. Pneumonia is a condition that can strike children, although we don't see as much of it as we used to, and some of it has to do with vaccines. But when we're assessing the child with pneumonia, typically we're going to have a kid that looks sick, so they're going to be kind of lethargic or sleepy. They might be flushed or feel warm to the touch, might be running a fever with it. And we may see some of the signs of respiratory distress too, like the nasal flaring, which is probably more common in children than it is adults, and then accessory muscle use and retractions. When we listen to their lungs, we tend to hear more crackles and rhonchi than wheezing, but we can hear wheezing with it too. Usually with wheezing, we think bronchoconstriction and bronchiolitis or asthma, but it is possible with pneumonia. A lot of times the abnormal breath sounds will be on one side of the chest, not the other, as the pneumonia, which most often is bacterial, although it can also be viral, tends to affect one lung, and then the other. Treatment for it is a position of comfort for the child, provide oxygen. Again, if they have an albuterol inhaler or beta agonist inhaler, we can assist them with that. A lot of times they will not. They do need to go to the hospital for antibiotics and further treatment. Now, because this is an illness, an infection that they've had, something we do need to consider is their hydration status, so you can ask mom or dad about how often they've been to the bathroom or how often they've changed their diaper, have they been drinking and eating properly, and make sure you check a blood sugar. Should check a blood sugar in all of our patients anyways, but sometimes with an infection they can burn through their calorie reserves a little bit faster and they might need some sugar with it.